Well, good evening, everyone, and I guess welcome back. I have not met you guys since the last year. Quite a bit has changed since then. So, I think today's session really is important regarding the vaccination process. So, if anybody has any particular issues with the vaccines or any questions, let's see if we can sort them out today. And before we begin and we tell you how the vaccines actually work, we'll give you a little overview of what vaccines are and what their functions are. Now, vaccines are not something that are brand new. They are present and been being used for approximately a century, and with different ways we are able to get people immune to certain diseases which were extremely lethal back in the day, but we have been able to control the infection of those diseases and the outcome of the disease that happens if you actually got those diseases. So, in simple terms, vaccines are of a few types. There is something called a killed vaccine or a live attenuated vaccine. Okay, so what happens is we take a virus which has different parts. It is made up of different parts. It's got an envelope, it's got a core, and they are different structures chemically, and your body recognizes each one of them in a different method. Now, what we do is we take that viral particle and we take out all of those parts, each part separately. We break it into different pieces. Now the virus is dead. It's no longer a single virum, that's what we call it, a single piece, and it's no longer virulent, which means that you are not going to get harmed by it if it enters your body. However, because it is pieces of the same virus that causes the disease, your body develops antibodies. These are soldiers that your body makes against those particles, individual particles. They could be 1, 2, 10 particles that we could be putting in a vaccine. Now, once this vaccine is given to a person, the very complex process of how immunity works, and I love immunology, it is fantastic. It's just a fantastic design in a human body that works, and these small particles, each part develops a different type of antibody, and your response in the formation of these antibodies is that you become immune to all of these diseases that you're inoculated against. Now, a lot of times breaking down and separating each particle of this virus is very difficult, and at those times the immune response produced by those small particles is just not strong enough, and you don't get a response from your body strong enough to be immune to that disease. So they came up with a different kind of a vaccine called live attenuated, in which they actually do not kill the virus. They just separate a part of it that they figure out causes the disease in the virus, and then they remove that part or genetically modify it in such a way that that part does not cause harm anymore. And so when this particular virus is injected in you, which is part of the same virus that causes the disease, then what happens is your body responds in making antibodies against it. So basically, it's not really medicine. It's actually the same disease, that causes harm. The virus basically goes in and causes the immune response without causing the harm. And therefore, you develop immunity against it. And what happens is that you no longer will get a disease which is strong enough to kill you. Examples are, for example, polio. There's a vaccine called Salk and Sabin. Now, this vaccine is basically a polio virus which was made harmless, and when it's injected into you, you develop the immunity against it. However, you don't get sick from it. Now, if you understand that why this is important, then you must have seen somebody who's had polio. Polio, the lower nervous system of the human being gets affected. The virus goes and sleeps in this particular part of the nerves, and these kids who will get polio will then have difficulty in walking because their muscle development will not be normal. So you can imagine how crucial this vaccination is, how devastating it must be for a parent to find out that their kid could have been completely normal and walking if they had gotten this vaccine at the time when it was a disease that could, cause the problem. So, polio also comes in a killed form as well, where the small particles of polio are given to you. And we have, right now, most of the people who are vaccinated against polio around the world through these drops. You see, they're not injected, they're just drops, and then they survive in your stomach as well, and they create an immune response. So you can imagine we have such miraculous people who have developed these things. And if you ever go through the story, the first one that happened about smallpox, the vaccine, the doctor actually tested it on himself. He made the vaccine and he had a theory, and he said, okay, you know what, I'll figure this out, and he injected himself. He got pretty sick, but that's what happens with vaccines. If you know that a lot of kids, when they will get vaccinated, inoculated against a disease, they will come back with a fever. It's because your body is responding. Your body is making antibodies against that virus or the dead particles or the live virus that we've inoculated you with. And your body responds by making the antibodies, and during that process we also have the other markers are raised which cause like fever and everything else. Now, so this is like a basic overview of what kind of vaccines we actually ended up using. But there are other kind of vaccines from beforehand as well. But this time around, COVID, which has grayed my hair in a year and tired me out completely, what we figured out is that this particular time we have had a vaccine which has never been used before. In a way, it has been developed, the process by which it has been developed, it is absolutely amazing. There are I'm going to tell you two basic type of vaccines that we have. There are subcategories and everything else over each one of those COVID vaccines, but the two major categories are the ones which are basically a vaccine like Pfizer, where they have an mRNA that goes inside your body. It goes inside your cells. It tells your cell or cells a genetic makeup or a map. It gives it to the cells. The the cells then realize that blueprint, and they start making antibodies accordingly, or that not directly, but what they do is they make those proteins that are similar to or mirror to the virus. Okay, now what happens is when your cells make those particular proteins which look like the virus, and they're being made inside your body, because those are individual parts and not the whole virus itself. Therefore what happens is those particles, when they come out into your body, into your blood, into your cells, and your body makes antibodies against those particles, and you get inoculated. Because now if the real virus actually goes in, you are already immune to it. Now we will come back to how the immune response actually works, just a brief review on it. But let me tell you about the other type of COVID vaccine that we've come across, and these are vaccines like Sinopharm or AstraZeneca, Oxford. These vaccines are basically viral particles, okay, or the live attenuated part of these viruses, which are slightly changed. For example, the flu virus is taken, doesn't cause much harm, and it is given the blueprint of a COVID virus, that these are S proteins and spike proteins and everything else it can make, and it's inoculated in you. Now it cannot cause the disease, causes fever and body ache and everything like that for a bit, but you get immune to your COVID virus without actually getting COVID from a vaccine that pretends to look like coronavirus. Now, as far as the immune response is concerned, there are two particular type of antibodies that we are interested in. One is called immunoglobulin M, the other is called immunoglobulin G, or IgM and IgG. As soon as a foreign particle, whether it be a virus, whether it be a bacteria, whether it be a parasite or fungus, enters your body, and it is not from your local system, your body instantly recognizes it as foreign. It's a complex system, how it is broken down by macrophages, made into small particles, then they are presenting proteins, and then they go to different cells, and the end result is that an antibody is formed. A very intriguing, very beautiful process that gets the antibody made. Now, in the first 7 days, you will have a peak of immunoglobulin M. So a person who has been vaccinated, or alternatively, a person who's got the virus, when he develops an immune response, his IgM antibodies, immunoglobulin M antibodies, will be the first to rise. So when you look at these patients or people, you will find their IgM levels to be higher. Now, if you were to look at the process further in detail, you will find that once the 7th day peak of IgM has reached, by the 4th and 5th day, the rise of immunoglobulin G starts. They start producing immunoglobulin Gs, which is the long-term immunity, and it starts to rise, and it starts to peak by the 14th to the 21st day. Okay? Now, as the IgG levels are rising, the IgM levels fall down and they disappear, and you're left with something called IgG, or long-term immunity, and you will have these antibodies floating around inside your body for a while, and every time this foreigner, a virus, bacteria, fungus, whatever, comes in, your body will be already ready to attack, shorten the time duration of this disease, and kill it. Maybe you won't even feel that you've had that kind of a disease before, and you will get better all the while because your body was already immune to it. So what happens over months or years after you've developed the IgG? A lot of people will start having the IgG levels fall down further and further and further, but they are left with something called memory cells. Now what these memory cells do is they are already having the genetic map or the information that what a foreign protein looks like in this particular virus, and as soon as that virus enters your body, those memory cells will not take long time like the initial first time infection, and they will immediately start making more antibodies immediately. So long-term immunity is achieved. Now looking at these COVID viruses, vaccines, there is sufficient and insufficient data regarding how long will their effect last. We have so far come across, I think, only one AstraZeneca, or was it Sinopharm, where we have to give a booster dose in certain countries after a third booster dose, which means a third dose after 6 to 7 months. But a lot of countries are going without it because they understand that memory cells are also there. So regardless, the immunity will be there once you're vaccinated. So I hope this kind of explains what an immune response looks like. I'm sorry, I've been really out of energy because of the current situation and work. So I couldn't make those fancy charts and everything else to explain it to you, but I'm trying to be as clear as possible so that everybody could understand this. Now, let's see if we have any questions regarding the vaccine at this point. All right, excuse me. All right. So far, nobody has questions, so we're good with there. Now, if anybody has any particular questions, you guys can ask me right now. I will probably be able to do that, but let me talk about a lot of questions that I've been getting in the hospital. For example, should I get vaccinated when I have a fever? And well, what it is, I'll give you a very brief understanding of why we tell people not to get vaccinated during a fever, and it's standard for every vaccine. You take your kid to the pediatrician and for their vaccination shots, and if he's got a fever, they say no. You wait until the fever is over. There are multiple reasons behind it, but one major reason is that you want to wait long enough to figure out what this reason for this particular fever was. Because to diagnose or differentiate when you've already been inoculated at the same time when you have a fever, you are going to be very confused with what particular reason is causing the fever, whether it's an infection or whether it's the vaccination which is causing the fever. So this is one of the major reasons, and so this is one particular part. The other theory behind not getting vaccinated during the process where you have a fever is that your body's already pretty busy with making a response against immune response against that particular virus, that it will not be able to do a sufficient job. I kind of disagree with that theory, but fair enough. A theory is a theory. So a lot of people ask me whether they should get vaccinated when they have a fever. No, absolutely not. You wait out 3 days, 4 days until you're settled, and that's about it. And you'll get vaccinated and you should be fine. All right, and so somebody did ask me something over here. Someone already had the virus, right? So say, for example, a person has had a COVID infection. Now the COVID virus has gone inside the body, it has mounted a response, there are IgG and IgM antibodies that are inside your body, but what we've noticed about this virus is and the immune response that it mounts against the virus, the body, is that after a certain number of months, your IgM and IgG levels almost go down to zero. So these people do need vaccine at the same time, though they have had the virus or the viral infection of COVID before, but they are somebody who will need to get inoculated again. Think of the dose of vaccine that you get after a viral infection of COVID as a booster dose, something to enhance your immunity while the pandemic is going on. It is still unclear at this point whether other vaccines will require booster doses, like Johnson & Johnson, Pfizer, and AstraZeneca, Sinopharm, Sinovac. There's a very long list, Sputnik. So if a booster dose will be required, only time will tell. We'll figure it out. But at this point, the reason we're giving the vaccines to people who have already had COVID before is because A, we're unsure how long their immune response will last. We have seen patients get infected by a different strain of COVID second time around. So just that during the pandemic, they have an immune response and they don't end up getting hospitalized. So Shahina, I hope that answers the question, will they get it again? Every patient that I have seen during this peak, let's say 25% was a reinfection. They have had COVID before and they had it again. So quite a high number. Yes, you can. Let me get to a few questions before I have something to say about, what does the vaccine do? What does it prove? So I'll come back to that. I had tested positive 1 month ago. Now I'm getting mixed opinions on when I have to get vaccinated. Please elaborate. In the US, the time period for getting vaccinated by any vaccine, whether it's Pfizer or any other, is 90 days. The current other countries which are inoculating people with the COVID vaccine who have had corona before is 60-day waiting period. So you wait for 60 days, and Oman is following the same thing. We are waiting 60 days, 8 weeks, okay, before we inoculate you. So if you've been tested positive a month ago, wait another month, come back to us and get the vaccination card. I hope that answers, Komi. Rukaya, do people that have had COVID a few months back need to take 1 or 2 doses? All right, so currently at this point, the Ministry of Health Oman has clarified that at this point they only need a single dose. Whether a second dose eventually will be needed as a COVID booster dose is not firmed yet, it's not confirmed. Currently, they will only be getting 1 single shot of the vaccine, and that should mount enough of an immune response to keep you protected. Okay? So, at this point, 1 dose. Shahina Al-Farsi, can you take the COVID vaccine if you have a fever or any upper respiratory illness? No, Shashina, like I explained before, at this point, you shouldn't be taking a vaccine if you have a fever, because if you do, then if you are somebody who's COVID positive or have had other illnesses, it'll be very difficult to clarify whether the vaccine caused it, whether the other disease caused it, and the whole process gets kind of really jumbled up. So that's why the process of waiting is there. When can a COVID recovered person get a vaccine? I mean, how long should he or she wait before getting the vaccine after getting COVID? Yeah, Kathy, it should be 60 days. 60 days later, you get vaccinated. Secondly, how long one should wait to get vaccinated when he is exposed to any COVID patient? Oh, okay. Good question, Komi. Reminds me that there are a lot of people who are not social distancing, so yes, they are getting exposed to COVID positive patients. If you have no symptoms, and there is no proof of an infection, you can get vaccinated immediately. There is no clear-cut plan on that. So what it is I'll tell you what. For example, there are two ways of figuring out whether this is or is not COVID that is going to cause the sickness. If a person A is exposed to a person B who has COVID, then chances are they will develop the symptoms between 0 to 14 days from exposing to that person who is COVID positive. They may or may not develop symptoms, but they, however, will develop antibodies and everything else against it if they are COVID positive on the 8th, 9th, or 10th day, or even 14th day. They should get tested on the day they get a fever, or if they want to be super clear in their head and they want to stay a little reassured, on the 8th day, just go 7 to 8 day where the immune response is the highest that you can get tested, and you will get a probably good, very accurate result. Okay, so if you're just exposed, you don't need to wait, you can get vaccinated. But if you want to be super sure, wait for 7 days when your immune response is to the maximum, get tested. The highest yield of the test is on the 7th, 8th day, and therefore you will be able to rest assured whether you did or did not get COVID, and then plan accordingly for your vaccine. In your experience, why are so many people denying the pandemic and saying no corona? Listen, man, Mr. Ray Peterson, I mean, there are anti-vaxxers around the world. There are, conspiracy theorists around the world. I can't really go and individually ask these people to change their mind. For whatever reason, they've been brainwashed or whitewashed with their information. We can't really change these people's minds. It's not just me. A lot of people have tried decades over and over again. Flat earthers will be flat earthers. What can I say, Mr. Ray? If you get COVID, can you take the vaccine, and how long after? So Jeanette, I guess I've already answered that question, but again, just to clarify, 60 days post-COVID, you are able to get vaccinated. Why has the fungus illness come out now, out of nowhere? Two particular reasons. Shashina, two particular reasons. We are using drugs for COVID people. You have to first understand this COVID illness and this fungus illness is not in normal COVID patients. These are patients who are very sick and end up going on either NIV or a vent, and they will find this mucormycosis there. It is the drugs. A lot of drugs that we use to prevent the virus from growing kind of make the immune response in a single direction, and therefore the fungus finds an opportunity and attacks. So that's particularly the reason. Still a lot of gray area. Okay. After tested positive or 60 days after 14 days of quarantine. Oh, Kathy, from 60 days from the day of the symptoms or being tested positive. 60 days from that day. So is it safe for those people who are having daily aspirin or any kind of blood thinners? Okay, so there are people, Rupa, that take a lot of blood thinners like aspirin, clopidogrel. There are other people who take warfarin, stronger ones. And needle insertion and going into the muscle with these people, okay, may cause a hematoma. So no, there is no problem in getting these people vaccinated. You just have to either stop the blood thinners for 3 days, or you follow the precautions very carefully. After assessment, you can do a PT-INR test, or you can do a INR test on its own. Figure out if you're somebody who's prone to getting bleeding disorders, and then accordingly you plan how to give the vaccine and what to do post-vaccination for these people. I hope that answered the question. All right, and people have the COVID. Can you take COVID if you have fever? Okay, so you have pretty much the same questions. Same there. We're having daily aspirin. Okay. How will the vaccine affect you if you have low immunity? Will you get very sick? Oh, Jeanette, excellent question. Excellent question. If you have low immunity, there are a lot of people who have autoimmune diseases or are transplant patients who are on immunosuppressants, are taking large amount of steroids or Cellcept or tacrolimus or these other immunosuppressant drugs. It is unsure how the vaccine will develop their immune response. They will not get sick from the vaccine. What we haven't figured out at this point is how strong of a response the body will make against the vaccine. The aim of the vaccine is to get immunity formation by the body, to make antibodies. Now, if a person is immunosuppressed, how strongly will his antibodies come out? We're not sure, but yes, they will be made. It's not like they will have zero immune response. They will have an immune response, but whether it'll be strong or not, we can't really say. But time will tell. These people should be careful, short or long run. I hope that answers the question. All right. Is there an MMH directive that people who had tested positive should only receive single dose? Is that the norm globally accepted? Christine, controversy, naughty. No. There is an MMH directive. There is a clear-cut directive that a single dose should be given to a person who's been who contracted COVID-19 and now has to get vaccinated later on. So post 60 days, they can get a single dose. Some of the countries are following that directive. Others are following 2 doses. Either way, immunity is achieved during a peak. So whether it is a single dose and later on we'll need a booster dose, or whether it's just a single dose, or whether there are 2 doses, you should get vaccinated. And yes, currently there is one, but people who got vaccinated early on in December and January, whether they will eventually at the end of the year need a booster dose or not, even that is not clear yet. It's a young vaccine. There are so many things that we're still learning how the body is responding to it. Following up on the aspirin question, Amreen, my father takes heart medication including aspirin. Is it safe for him, or are there procedures and tests we need to prior after vaccination? Well, in heart medications, if he's not taking warfarin and if he's taking clopidogrel and aspirin at this point, like Plavix and other brand names that are there, then there are 2 ways about it. Okay, obviously you need to have a clearance from your cardiologist, obviously. But what the general understanding of this procedure is that if they can stop their medication for 3 days and get the vaccination and then go back to it after 3 days, that's it. Nothing to do. You can stop and restart. We do that a lot of times with surgeries, like for example, dental extraction, or if we're about to go into a surgery, we tell the patient to stop taking aspirin or clopidogrel 72 hours prior to their procedure, and then we restart it after. So no biggie. But if it's somebody who has to mandatorily take it, it is impossible to stop it. It is a part of their life. It is a life-saving part of drug in their system. Then what we do is we do a test called PTINR, and PTINR actually tells us if the patient's bleeding tendency is more or less, and then accordingly we plan. I hope that answers it. Jeanette, as you just mentioned, that it's a young vaccine and there is so much we are still learning about it. Do you think that the future complications or side effects could arise? I did a very clear-cut calculation on this one, by the way. A lot of people think that, oh, if I do this, whether I will have that and everything like that. Jeanette, I have very simple explanations for this. I would either choose A, get vaccinated and not die, or B, not get vaccinated and get really complicated, maybe survive, maybe not, take a 50-50 chance. It's pretty difficult to choose something like that. Every time you get into a car or an airplane, you're unsure whether it's going to land or reach the destination or not. But that does not prevent you from getting into the car or the airplane to reach your destination. Okay. Yes, a lot of people will then say, oh no, this is something permanent and it may cause problems later on and this and that. Every single thing that you read in medicine, every single thing in this world has a side effect, has a probability ratio of getting sideways, of maybe causing problems, potential problems later on. But you have to weigh whether the problems outweigh the inoculation or the inoculation outweighs the problems. And in this particular instance, the world is literally suffering. Families upon families are dying. It is a preventable disease through masks and vaccinations. We can together get back to that normal that we came from. Having a mindset and thinking, oh, it will not work. Maybe I'll have such and such and such problem later on. What is the guarantee at this point that we will live long enough to see those side effects? Smokers will smoke knowing that it causes cancer. Some will die without it, some will die with it. Does that mean smoking doesn't cause cancer? No, it doesn't. Or does it mean that he will stop? No. A lot of people have difficulty in stopping smoking. So you have to outweigh the hazards. Okay, so in this particular instance, the efficacy or efficiency or the need of vaccination outweighs what will come in the future. When it comes to pregnant women, all right, at this point there are 2 studies that I've read regarding people who are pregnant and have been vaccinated or had COVID and have been who were pregnant and had COVID. There's something called a vertical transmission, where the mother's antibodies cross into the baby. And we've had, in that one particular paper, we've had the response in the child by being born with antibodies against COVID. You have to outweigh the hazards. If the vaccination process outweighs the potential risk it may cause to the pregnancy, then you might as well get vaccinated. But if the pregnancy is precious and the pregnancy outcome outweighs the vaccination, then currently you wait. At this point in Oman, they are not vaccinating all pregnant women. They're looking at it and they're choosing who they want to vaccinate, for who it may be safe and who it may not be. I hope that answers the question. Okay. Including heart medication, test positive should receive a single dose. All right. So there was something that I had wanted to talk about regarding the vaccination process, but most of it was covered by your questions, and hopefully it kind of stays there and I get you some more information out on it. A lot of people have a problem. Oh, I want Pfizer, or I want AstraZeneca. AstraZeneca is banned in under 40s in certain countries and over 40s in certain countries, and this vaccine doesn't allow us to travel, and that one allows us to travel. My straightforward opinion is, when this vaccine came out in Oman, I was one of the very first one to go in line. Took my family, went straight to the Ministry of Health center that was designated, said, I'm here. I didn't want other people to wait. Like they were waiting and they were seeing that, okay, let the guinea pigs go through the vaccine, and if there's any problem, then we won't take it. And if there isn't any, we will take it. These vaccines have gone through quite a bit of a speedy trial, and hundreds of thousands before you have taken it. And the potential risks and benefits are completely weighed in. And the benefits definitely outweigh the risks, definitely. And I don't find any horn on my head's post-vaccination. I don't really crave for flesh. I don't eat humans anymore, like, post-vaccination. So I don't think the vaccination caused a zombie apocalypse. So definitely you can get vaccinated. I don't think there's a problem. Okay. Uh, you have to understand, a lot of people have used social media as their primary source of information. I can't deny that, because this is something that is happening around the world. The WhatsApp University of Medicine is causing a lot of problems. There's a lot of misinformation out there. You have to understand, each disease presents in each race differently. When we are studying medicine and we have these medicines, say for example for blood pressure, we are actually told and we learn what drugs to give in what race, because what problems those drugs can cause in a potential race. Okay, so it is part of medicine. It is not racism, it's part of medicine. Each medicine acts differently in each race, and therefore you have to choose what you're about to give your patient. And it is trial and error that happen, and then eventually we reach that conclusion. Okay? You have to understand, this is medicine. This is not something which is absolute. Somebody will have to end up using it to figure out what the effects of these medicines in humans will be. There is something called a human trial. Okay, and the drug goes to a human trial after decades of going through animal and petri dish tests and so much and so on and so forth. So if you think that you will wait until somebody else uses it and then sees what problems it causes, and then you will make a decision on that, I'm sorry, your experience might be completely different. Post-vaccination, since mass vaccinations have now started, I'm seeing so many patients now post-vaccination that develop fever, body ache, severe body ache. And I see patients who have zero problems. They don't even develop a fever. Same vaccine, same age group, completely two different responses. So don't wait on other people's experiences, okay? Because their experiences might be very different from yours, and yours might be very different from theirs, okay? So go ahead, get vaccinated, get people vaccinated, go in. I practice what I preach. I've been vaccinated. I was one of the first ones here. I went in and they were quite happy in vaccinating me. I'm dealing with COVID patients every day, all day. It's a nasty disease. It has caused suffering, not just to the humankind, to families, friends, colleagues. People always said, oh, it doesn't seem to be that lethal. Oh, we don't see everybody dying over here. It's okay. Social distancing. 2 years, people have not even learned how to wear a mask even now. I'm so sorry to say this, but 2 years down the line, there's still a naked nose mask. I don't know. 2 years down the line, if they haven't learned that, I don't know. We can't really change everybody's mind. Sad state of affairs. Disease is lethal, causes a lot of problems and suffering. So if this is the only way to stop it, why not? Why can't we just contribute to humanity, to the world, to just the well-being of everybody? The vaccine does not guarantee at all that you will not get COVID. It guarantees immunity against it. Immunity doesn't mean that it cannot come and attack you. What it means is that if it does come in, it will be taken care of swiftly.
it will be destroyed, and you will not end up in an ICU or ventilated or in a serious disease. So that's what it guarantees. It does not guarantee that you will not get infected. So, what's the take on the matter? Get vaccinated, stay safe, social distance, okay, still sanitize your hands. This isn't over yet. All you need to do is continue with the precautions, get vaccinated, and you should all be fine. I don't think there should be a problem. You guys are welcome to questions later on when this video is posted onto the group, okay? And you can ask any questions and I'll try to answer them as much as I can. Thank you for all that you're doing. It's not an easy thing for you. Thank you for continuing. Oh, it's very hard. Shashina, it's very, very hard. I'm on the brink of breaking out into a mad rage every day. But I try to control it. Asia, in Bahrain, so many people are vaccinated, about 17%. Why are their cases so high? Like I said, Asia, again, it is not something that'll prevent the disease. It'll prevent death. It'll prevent the complication of the disease. Okay? Vaccination does not say that you will not get infected. It says you will get infected, maybe, but you will not die of it. That's what the vaccine guarantees. You know, a lot of people have that thing, oh, Pfizer is efficacy this, AstraZeneca efficacy that, Sputnik has efficacy this. You can't even... The process of determining what an efficacy is so difficult on its own when you have a placebo group and you have a group that is getting vaccinated. That itself is such a difficult procedure, and it just depends where you're testing it. Where is the research happening? So say, for example, it's happening in the middle of a country of 1 billion strong where the outbreak is massive and it's the peak, and you test the vaccine during that time, okay, the efficacy might come out different compared to a country which is just, say, for example, 1 million strong and are pretty much having 4 or 5 cases. If you test the efficacy in that, it'll just probably be 100%. Do you understand? So efficacy is not the reason to choose a vaccine. The reason to choose a vaccine is what is available, what is there. And yes, obviously there are certain people that are preferred over to Pfizer by the doctors because the benefits of those vaccines outweigh. But that's the doctor's decision, not the patient's. Okay? They will make sure that the person who is for Pfizer is given the recommendation for Pfizer and then gets Pfizer, rather than if he deserves the Pfizer vaccine and then ends up getting AstraZeneca. No, it's not like that. The doctors are determining it, and every day I do it every day. If there's somebody that I'm sure that is not good for AstraZeneca, I tell them, for you it's Pfizer. My consultants do the same. Internal medicine specialists do the same. And if there's somebody who is supposed to get AstraZeneca, we tell them, we reassure them that, okay, it's okay, you can get this. Jeanette says, I've been hearing that more and more children are getting COVID. Previously, it had been that they couldn't catch it or didn't affect them strongly. What is changed since then? The virus keeps changing, and its genetic structure, its virulence, everything else keeps changing with it. And yes, the previous versions were not as bad for the children. The current versions are stronger. I have quite a bit of COVID positive children that are my patients, but touch wood, thank God, alhamdulillah, not one of them is complicated. Not one, alhamdulillah, not one, not a single one. Youngest one was one year. No, youngest one was 3 months old. Youngest one was 3 months old, yeah. And we didn't test the child, but the entire family tested positive, and the 3-month-old had the disease as well because same symptoms were there. And so it's a simple deduction. So yes, the kids are getting it, but thank God so far very few children end up in the hospital in Oman. Very few. Like literally you can count them on your finger. So overall, children are still safe. Are they running the vaccine testing so that children will be able to take it? Yes, US just allowed 12 and above. and I think UAE allowed 12 and above. We are at currently 18 and above, so yeah, we're getting there. All in good time, Jeanette, all in good time. Well, I hope this answers all your questions. I hope you guys stay safe, keep socially distancing, get vaccinated, stay strong. And if there are any questions, just ask on the video and I'll answer them, inshallah. Take care, guys.